lupus group of disorders. Lupus group of disorders. Systemic lupus erythematosus is one of the most challenging cases that we can confront, because it will behave in a very different way when the treatment progresses. Let us discuss discoid and systemic. Discoid is quite a bit rare, but SLE we get. Discoid is confined to head and neck, which is called localized DLE, and very rarely it can spread all over the body with scaling and the features of erythematosus SLE itself, and with a very less possibility of Raynaud's phenomenon. 2-3 days before in our OP, we got a DLE case. Because I could not get a photo, I had to add this. DLE rarely is seen, but commonly we get the case of localized DLE, which is confined to face. And at the most, it can go towards the chest. But the features are very common. This is the way. It will extend a little bit more, 1 or 2 centimeter extended lesions also we can see. Localized DLE, face and head. We should not confuse the lesion with the seborrheic dermatitis. We should never confuse the lesion with seborrheic dermatitis, because seborrheic dermatitis is a little bit irritable case for the doctor and patient, but this is more we have to deal with localized DLE more seriously, because it can take drastic turns at times. Systemic disorders and deformities can also develop, and it can later turn on to a discrete lesion also. This is DLE, disseminated DLE, which is seen all over the body. We had a small boy from Chennai with this diagnosis, from Chennai, and we had treated him by admitting him, by doing Virechana Karma, and then we treated with the Pitta Shamana Rasayana. We need Vata Pitta treatment here. The lesions of DLE may occur in widespread pattern to the trunks and limbs. The photograph itself is a classical feature. Any patient will come in this way only. There won't be any shedding of skin. There won't be any blebs, vesi, nothing will be there. But this will be the feature: hypopigmented, irregular, non-specific sort of structures will be there. Different designed patterns will be there. There won't be any round, circular, small, big, nothing will be there. It won't have any specific shape at all. Then we have to suspect a DLE and definitely go for hematological analysis. This is a little bit more affected erythematosus, but the features won't change, just for our interest. Next comes SLE. Cutaneous erythema on light exposed area is the most common feature. Let us not confuse it to photodermatitis and discoid erythematosus, because butterfly rash with fine scaling on butterfly area on the cheeks is the common feature. But there will be necrotic changes even in severe cases. And in the hair, in the scalp, there will be alopecia. The patient will lose body hairs also. And also the patient will be having urticarial wheals, which is non-itching. If any patient comes to us with the non-itching urticarial lesions, which comes without any predisposing factors or aggravating factors, we have to suspect LE. And this livedo reticularis is the diagnostic feature also. A bluish red discoloration which blanches on pressure. Blanches means vanishes on pressure and is not affected by temperature changes. Not affected by temperature changes. Which one should I repeat? The feature, how to distinguish? This one, SLE is more common, and butterfly rash is the diagnostic criteria. There will be tissue necrosis also. If the case gets more severe, we have to do hematological tests, which is related to immunology, and the patient will lose the hair. He will be having alopecia on the scalp as well as on the body, but the patient will have also come to us with the non-itching urticaria, where there will be urticaria, but there won't be any predisposing or any causative or aggravating factors in relation to food or for any exposure. It will spontaneously develop, but these urticaria will not have itching. That is the cardinal feature. And the other feature is the diagnostic feature, bluish red discoloration, which vanishes on pressure and it is not at all affected by any change in the temperature. That means the patient won't complain that such features like those red discoloration is not appearing when he goes to the sunlight.